Let's go ahead and get this healthcare forum started, right? I'd like to introduce our first speaker, Kenneth G. Hartman. Ken is a security consultant um, and a SANS certified instructor. He teaches SANS SEC 510 and SEC 488. Ken is going to be kicking us off today with a talk on threat landscape and digital transformation and sharing some of the challenges unique to healthcare. Ken, welcome. Thank you for being here with us today. The digital stage is yours, sir.
Thank you. So how do I get my slide share from the green room into the main room? There we go. Thank you. Appreciate that. So yeah, I'm going to be talking about the threat landscape a little bit, the digital transformation, and really looking forward to being here and having this discussion with you. So I started my journey in healthcare back in 2002 when I helped launch a company called Visionex. And I think Visionex was one of the very first health IT software as a service companies. And this is back before software as a service was even a buzzword. And we focused on dialysis centers, and we helped the hospital-based dialysis clinics compete with some of the chains here in the US, DaVita and Fresenius, to name a few. I was also on the Health Information Management System Society Privacy and Security Committee, and that was a very rewarding experience. And I still consult in the healthcare space to this very day. So while I'm talking about the threat landscape, it may sound a little bit like I'm preaching to the choir, perhaps. But one of the things that I've seen is, just to throw out a medical term, sometimes we can get myopia where we're just so used to doing what we're doing. And I think that's why forums like this are so important for this exchange of ideas and talking about problems, some problems that are unique to us, others that are common across the industry. And I was very excited today to see the lineup of topics. So I see it as my job as the first speaker to get you thinking, share a good story or two, perhaps make you cringe. And we'll also talk about how far we've come and where we have yet to go. So when it comes to thinking about the threat landscape, the first thing that I think of is just the massive physical attack surface area that healthcare providers have. After all, to be effective, healthcare must be accessible. This means public locations that are concentrated in the population centers that they're serving. So this slide here is showing Kaiser Permanente, but it's just showing their Northern California region. And you can see that they have a massive footprint. So we're talking about Kaiser Permanente on one extreme as a very large provider, but this goes all the way down to the smaller practices. As an example, my brother is the executive director of a substance use disorder provider. They have 3 locations, about 150 patients as their census, and about that many staff as well, because it takes a lot of staff to deliver that type of treatment. But one of the things that we note, especially in the cloud, is that scale changes everything. And not only are there all these locations, but most of these will have guest Wi-Fi networks, which really makes the challenge of securing these environments very difficult. And as I was thinking about this, the second thing that popped in my head is that there is massive networks that are required to support this big physical footprint. And on top of that, these facilities will often be using medical devices, which, of course, to maintain their FDA validation in the US, the way that you go about patching these vulnerabilities truly matters, because you don't want to impair that validation. So, of course, our historical approach to this has been to use network segmentation to isolate these vulnerable devices. I think back in the early days, the technique was simply just to disable the switch port. So, of course, me as a vendor in the hospital trying to get things done, what I would do is I would unplug a PC that was powered off so I could jack in my laptop and get onto the hospital network. And if that didn't work, we could always unplug the multifunction printer. So, yeah, are you cringing yet? So obviously, there's a real need for strong network access control in these facilities. Of course, this was back in the 2002 time period, and this is when I learned all about La Brea tar pits because I was scanning a hospital network. I was looking for an available IP address to use because they weren't using DHCP, and and of course, the La Brea tar pit, which was actually very effective in preventing the scanning, brought things to a grinding halt. But interestingly, no alarms went off and nobody investigated to see what was going on. So I think that's another challenge, right? Is we all need staff to be able to chase down these alerts that may actually be the precursor to a serious security incident. Then when it comes to our networks, we also need to make sure that we've got effective egress filtering in place. So when I was just starting with Vizinex, this is back in the 2002 timeframe, we, rather than selling our services as a software as a service solution, we sold it as an appliance that got installed right there in the data center. Or more often than not, it was installed in the nurse's station. And there we would use either FTP or HTTP to upload the backups to our data center. That way we were delivering on the HIPAA requirement of a offsite backup. And we also had a heartbeat. One time we observed that one of our devices was stolen because we stopped getting that heartbeat. And yeah, one of the patients walked out of the dialysis center with our computer in their hands. This was in inner city Chicago. Now, another item that is generally on people's threat radar is ransomware. And Ryan Chapman will have a whole discussion a little bit later on ransomware. So I certainly don't want to steal any of his thunder, but this certainly needs to be on our threat radar. After all, healthcare was the third most targeted industry for ransomware attacks in 2021. Ransomware attacks were responsible for close to 50% of all data breaches in the healthcare industry in 2020. And to make matters worse, since backups are a partial defense against ransomware, there's now a trend toward dumping the data on the internet if the ransom's not paid. So all told, the healthcare industry has suffered over 157, and this is in the US, $1 million in losses due to ransomware attacks since 2016. The other concern is credential compromise. When legitimate credentials are compromised, it becomes very hard to differentiate the activities of a bad actor and the victim user who's being impersonated. Now, multi-factor authentication definitely helps, but attackers are continually working on ways to circumvent MFA as well. And I see credentials as an exponential problem. So if your organization has, say, 1,000 employees, and those 1,000 employees are accessing just 10 different services on the internet, well, now you have 10,000 different identities to manage unless you're using single sign-on for everything. A buddy of mine was implementing a cloud access security broker, and he said that they observed while it was just in the listen and learn mode that they had over 1,500 different internet services that were being accessed from this biotech company. And think about the challenge of offboarding an employee. This is such a critical capability, right? Because when we revoke somebody's access, we need to make sure their access is revoked for all applications. One of my clients had a SaaS application administrator. This is the person that creates new users and makes the system configurations. Well, she started having some performance issues, so the company decided to terminate her employment. And we found out later that she had a couple of backdoor accounts in addition to the account that was disabled. So making sure that we have completely offboarded a highly privileged user, I would say, is a very important capability. Now, when it comes to sensitive data, it's very important to make sure that we're logging any configuration changes that impact the security configuration of the system. It's also important to make sure that we're logging all create, read, update, and delete operations. And you all know this. This is in the US, it's a HIPAA requirement, and it's pretty much a universal requirement for any system storing sensitive data. But one of the things where I see many software as a service solutions fall short is they're not logging the read access. The other thing that I'm very much a stickler on is I want to prevent direct access to the database by database administrators, right? Because this is not shown in the application access logs. So I push for services to have only one door. That's the front door where they're going in through the API or the web user interface. This way, I know that all access is being logged as data is moving in and out. COVID certainly has impacted our digital transformation. It's resulted in more folks working remotely. It definitely has created more of a demand on healthcare services. There's also been staffing challenges and supply chain issues. So let's take just a few moments to talk about digital transformation. Of course, one of the first things that people will talk about whenever they get a chance is zero trust. And I kind of cringe because it's starting to become an overhyped buzzword, but yet zero trust is a very important concept, and I think it is definitely a positive trend. Gartner, they're projecting that 30% of organizations will adopt a zero trust network access model by the end of 2024. So I think that's really good. Of course, this all started with Google's Beyond Corp and some of the idea leadership that they put into place after the Aurora attack. And of course, now they have their identity aware proxy. Azure has their conditional access, and many other solution providers are offering solution in this space. But I have a very simplified way of thinking about zero trust. If you have, say, system A, and system A does not need to talk to system B, do not allow network connectivity whatsoever, right? That just prevents a lot of abuse. But if system A does need to talk to system B, we want to make sure that there's strong authentication in place. When we're embarking on our digital transformation, this will often be done in concert with other service providers, whether they're cloud service providers or any type of IT outsourcing or service delivery of any form. Now, there's two different types of agreements. Generally, there is negotiated agreements and there are standard agreements. And from my experience, most healthcare organizations, they're used to working with the negotiated agreements. For example, when they're in the process of implementing a new health information management system, maybe it's an Epic system or whatever, right? So you'll go back and forth, often in Microsoft Word, redlining things that you want to have changed in the contract till you agree upon something that both companies can support. But when you use a large cloud service provider like AWS, the cloud agreement is basically boilerplate and it's offered in a take it or leave it manner. And this really comes down to the disparity and the negotiating power between the two. So the reason why I bring this up is because I want to make sure that we don't have any contractual vulnerabilities that will impact our security posture as well. And I worked previously for a company called Illumina, and I was on the negotiating team on the Illumina side as we were in talks with the Mayo Clinic. So this was a press release, just so that I'm not speaking about something that I shouldn't. And my involvement was making sure that what we had agreed to in the contract, we could actually deliver upon from a security perspective. And in the classes that I teach, I always encourage cybersecurity leadership to get involved and to support the negotiation. Because as you can see, based on the items that I've highlighted here in red, there are many things that are of concern to the security team. So we want to make sure that people aren't making commitments that we can't deliver upon. So these bullet points come from a LexisNexis article. I've put the URL there in a shortened URL on the bottom of the footer. But I added the highlighted items to make it relevant to a healthcare setting. In the US, we use business associate agreements as an addendum. Oh, and by the way, you want to make sure you know where all your contracts are. There's nothing worse than scrambling around in the middle of a security incident, trying to figure out what you agreed to. And whenever you have enough purchasing power, maybe as a healthcare organization, where you can strong arm a service provider in modifying their standard agreement. Remember, their whole premise is built on doing things in a very standardized manner. So when you are able to get them to make certain modifications, for example, I don't know, in the breach notification timeframe as an example, make sure that they're actually able to deliver upon that change and that they're tracking that is a change from the way that they would do things in a standardized manner. All right, so now that I've hit upon all these issues and challenges, I feel duty-bound to provide a path forward. So one of the things that I caution people, especially managers, is to avoid the buy another tool syndrome, right? So I've seen various clients that will use multiple different vulnerability scanners as an example, or multiple different solutions. And they're not really using any of those well because, for one thing, they fail to properly staff it. It's one thing to make a capital purchase, but it's another thing to allocate headcount to managing that system year over year. But when I'm starting on a new engagement, I almost always start with the CIS controls and perform an assessment, right? Often this starts with creating inventories, right? As we say, how can you secure what you don't know about? So if you've never done this, definitely do check this out. You can download the controls and you can do a free self-assessment. In fact, the Center for Internet Security even has a dashboard for tracking purposes. And the implementation groups over here, these are designed to match up with any level of maturity. So with that, I'm at time. So let me open it up for a few minutes of questions and discussion.
Hey, Ken. Great stuff. Let's see what we got. If anyone has any questions for Ken, drop them. Feel free to drop them in the chat right now. Not seeing any questions just yet. Love that graphic though.
Yeah, it's one of my favorites.
Well, I appreciate you. Thank you very much for what you've shared here.
Oh, looks like we did get a question in from Stacy. So what is the hardest aspect of ensuring compliance? So one of the things that I've seen is especially on the solution provider side, where maybe to earn business, one of the things that they'll do, or to reduce that sales friction, is they'll go after some sort of public certification like ISO 27001, or maybe have an audit firm come in and audit them for GDPR. So they're motivated to win this certification and be able to brag about it in their marketing efforts. But like in the case with ISO, where it's a 3-year certification interval, that recertification is actually hard, because now all the excitement and the upper management support has waned. And we've seen that, well, for example, with vulnerability remediation, that they've started to let their numbers regress. So we, as the security team, we need to keep the focus on making sure that we maintain those security controls on an ongoing basis, maintaining that continuous compliance. So Anthony asked, where do I find the CIS dashboard? So I'm going to live dangerously. I'll try and pull up my browser here, since I think I'm still sharing my screen. And I'll let's see here. Actually, what I would do is I would just do CIS controls, and then when you're doing a search in there, you'll find the dashboard. Yep. So it's a very wonderful tool, and it does use strong access control. So if you have any concerns about that, the other thing that you could do is you could download a spreadsheet and then track the controls internally, if you didn't want to share that information with whoever's managing the CIS website. So great question. All right, I'll turn it back over to Stephen.
Fantastic. Thank you so much, Ken. Appreciate having you here.
It was